Hi there. I'm excited to talk to you today about a topic that's been around for a while in compounding pharmacy terms, but may not commonly be known about in general medical terms, and that's what is Pyrrole disorder and how is it treated. It's something that is quite technical, so please excuse me if I get the terms wrong, but Pyrrole is often called pyroluria, and it's really linked to the body's production of a substance known as hydroxyhemopyrrolin 2,1, abbreviated as HPL. And in people with this Pyrrole disorder, they often have higher than normal levels of this substance. And HPL binds to key nutrients in the body. So you find that when that occurs, the patients that might suffer have a lower than normal level of these nutrients. So those nutrients are especially zinc and vitamin B6. And sometimes, well, what we commonly see in practice is when people are low in those sort of key nutrients or minerals, things like anxiety, stress, poor tolerance to stress, fatigue, sensitivity to noise and light, those types of things can be a little harder for people to navigate than someone that doesn't have a high level of HPL. So it's a challenging one to diagnose because it does require a urine test. The availability of these tests may not be every pathology service, so you do have to talk to often specialised integrative doctors who have got a big exposure and have a depth of experience with Pyrrole disorder. And then once you've spoken to someone familiar with it, they might often look at using a variety of supplements. That could be things like vitamin B6, like I said, which is called pyridoxine otherwise. It could be a form of zinc. And there are other things too, which is like you could look at vitamin B5s, and there are some other ones in there as well. So as always, there's not a one-size-fits-all approach to solving this problem when someone might have a suspected Pyrrole disorder. But the cool thing about compounding pharmacies like ours at National Custom Compounding is that we can make a supplement specific for a person and specific for the nutrients that they might be deficient in. So for example, we do treat patients in this particular category, and for kids, we might look at making them a topical cream, which contains a variety of these vitamins, or we might look at making them a powder to blend into a liquid to drink every morning, or for adults that are being treated in a similar way, we might use things like capsules to make it tasteless and simple to consume. So the beauty is a compounding pharmacy under advice of a health professional for a patient will make any product that's required and will make it customized specifically for them. So if you've got any more questions on Pyrrole disorder, feel free to reach out and chat to one of our compounding pharmacists. And always, we're more than happy to chat. Have a great day. Thanks so much.